So let's start with the second part of angina, that's treatment options available for angina management. So we have already seen the treatment goals in angina. We know that oxygen supply to the heart wall is less compared to demand, and in management we have to see how we can reduce oxygen demand by the heart wall. We can reduce oxygen demand by reducing the workload on the heart of the heart wall. How to reduce workload? By decreasing heart rate, contractility, preload and afterload on the heart. So which class of drugs act in this manner? Beta blockers and calcium channel blockers, they reduce heart rate and contractility. Organic nitrates and calcium channel blockers plus other vasodilators, they reduce preload and afterload on the heart wall. So overall the workload is reduced, oxygen demand is reduced by the heart wall. How to increase supply to the heart wall, oxygen supply to the heart wall? By increasing blood flow to the coronary artery, through the coronary artery, and by increasing regional myocardial blood flow. So vasodilators are the ones which act in this manner. They increase blood flow. Also statins and antithrombotics. So statins and antithrombotics, they will dissolve the plaque in coronary artery, and that's how they will increase the blood flow. So if we see treatment options, we have to consider the phase of angina. Like, do we need the drug for treatment of the attack, or we need it for preventing the attack? So the drugs, organic nitrates, few organic nitrates like nitroglycerin and isosorbate dinitrate, when they are given sublingually, the onset of action is very faster, and these are the ones which are used to treat the acute attack. When the attack is coming, immediately the patient can take this sublingual tablet and can observe the relief. But to prevent the attack, again, there are different class of drugs. First of all, the most important ones is organic nitrates. Here the organic nitrates are not given sublingually, they are given generally through other routes of administration, more commonly orally. So and that's why onset of action is slightly delayed, but they have longer duration of action. Vasodilators, they dilate the blood vessels and reduce preload and afterload. And there are few other class of drugs also, which the rationale we will see how they are used in angina management. So overall in this chapter, what we will focus is organic nitrates and few important points about these miscellaneous drugs. Vasodilators, how they are reducing preload and afterload, and how they are showing their vasodilation, and what are the structural activity, all those points we will see in antihypertensive drugs altogether. Here what we will focus is organic nitrates. Let's see mechanism of action of all the organic nitrates. How do they function? Whenever these drugs are administered, they enter in the blood. The drug is absorbed from GIT to the blood, and then from there it is getting metabolized in presence of an enzyme called aldehyde dehydrogenase. Because of the action of this enzyme, nitric oxide is donated or released from the parent drug like nitroglycerin or isosorbate dinitrate. Those drugs, organic nitrates, they are releasing nitric oxide in presence of aldehyde dehydrogenase. Now this nitric oxide is entering inside the tissue through the membrane. The smooth muscle cell tissue of the blood vessel, and in that cell, what is it causing? It is causing activating guanylyl cyclase enzyme. Now this guanylyl cyclase enzyme is converting GTP into cGMP. The increased level of cGMP in the cell is activating protein kinase G enzyme. This enzyme is now activating myosin light chain phosphatase enzyme. So this is the main effect of nitric oxide, that it is activating CGMP, increasing CGMP levels inside the cell, and that is activating MLCP enzyme. Now this plays an important role in vasodilation of the smooth muscle cell of the blood vessel. How? Let's see. Generally what happens, there is myosin inside the cell, and these myosins are getting phosphorylated in presence of myosin light chain kinase enzyme. Once this is phosphorylated, it will interact with actin, and this interaction will cause contraction. So for contraction, always this phosphorylation is mandatory. Phosphorylation will happen, then only this interaction can happen and contraction can happen. But now this MLCP enzyme, as the name is suggesting, phosphatase, it dephosphorylates myosin molecule. So it is removing the phosphate molecule from myosin, and that's the thing which is inhibiting this interaction, actin myosin interaction. So no interaction, no contraction, that means it will cause relaxation, which is called vasodilation. Okay, so this vasodilation will help in decreasing preload on the heart. It will decrease afterload of the heart, and it will increase blood flow in the coronary artery to the heart wall. So this is how nitric oxide, the organic nitrates, they are donating nitric oxide molecule, which is increasing CGMP levels inside the cell, which is activating MLCP, which is causing dephosphorylation of myosin, and that's how it is causing vasodilation. The pharmacological effects of organic nitrates include hemodynamic effect, where it promotes vascular smooth muscle relaxation, and that's how it is causing vasodilation. It increases coronary blood flow by definitely causing coronary blood vessel dilation. So since the blood flow is increased, more oxygen is reaching to the heart wall and the anginal pain will be relieved. It also has some effect on reducing myocardial oxygen consumption or requirements. How? So since there is a vasodilation, the preload and afterload on heart will be reduced. Now this reduction will reduce overall workload of the heart, and since workload is reduced, the oxygen requirement by the heart wall will be reduced. Some other pharmacological effects also include the relaxation of smooth muscle cells of bronchi, biliary duct, and relaxation of the cells of the GIT wall. So these might include some side effects related to these organs, like GI side effects and all. The enzyme aldehyde dehydrogenase, which is releasing nitric oxide from organic nitrates. This enzyme is present more in veins. The amount of this enzyme is more, and that's why there is predominant venodilation with organic nitrates rather than the dilation of arteries. Venodilation is more common with organic nitrates. The drugs to these are the organic nitrates which are used to treat acute attack rather than preventing. These are preferred for treating when the attack is happening. So amyl nitrate, glyceryl trinitrate, and isosorbate dinitrate. This glyceryl trinitrate is also known as nitroglycerin. Now in this, if you see, glyceryl trinitrate is available in multiple dosage form for different route of administration. The onset of action for amyl nitrite is minimum, like very rapid onset of action, 15 to 30 seconds. But the problem is its duration of action is also very less, hardly 1 minute. Nitroglycerin, the onset of action is around 2 minutes, very rapid onset of action when it is taken sublingually, and the duration is also significant, that is 30 minutes. Isosorbate dinitrate, its onset is 3 minutes and duration is quite longer compared to nitroglycerin, that is 4 to 6 hours. These two drugs, they also have active metabolites. Nitroglycerin can be converted into dinitrate metabolites, which is active, and also isosorbate dinitrate can be converted into mononitrate, which is active metabolite. Now, since amyl nitrite is having duration of action very less, very short, that's hardly 1 minute. That's why this is not preferred one for treating the attack. The nitroglycerin is the preferred one for treating attack. Uh, Isosorbate dinitrate is also an option, but when you see there is just 1 minute delay in the onset of action, but this delay of 1 minute can also be unacceptable for some patients when there are chances of getting, anginal attack. And that's why nitroglycerin is the preferred one, which has rapid onset of action, can be taken sublingually and easy administration, and has significant duration of action as well. Organic nitrates are lipid soluble, and that's why they are well absorbed from buccal mucosa, intestines and skin. Most of them, they are administered orally, and all of them, they are metabolized in the liver and undergo first pass metabolism, except isosorbate mononitrate. All are rapidly denitrated by glutathione reductase enzyme in the liver and mitochondrial aldehyde dehydrogenase enzyme. The partly denitrated metabolites are less active, but they have longer T-half. Like isosorbate dinitrate is metabolized into isosorbate mononitrate, which is a less active metabolite, but it has a longer half-life. These are the organic nitrates. The glyceryl trinitrate, which is having 3 NO2 group, erythritol tetranitrate, which is having 4 carbon attached with ONO2, penta-erythritol tetranitrate, where 5 carbons are there but 4 ONO2 groups are there. So penta-erythritol tetranitrate. So we have seen all these organic nitrates are nitrate esters, which makes them very much volatile. And that's why there is potential loss of active drug molecule from the formulation during manufacturing process. Their exposure to the moisture should be avoided because it might lead to hydrolysis of the active molecule. And since they are nitrate esters, they are very much explosive. And that's why when they are manufactured in specific vehicles and along with few excipients to reduce this potential hazard. Although these organic nitrates, they are, because of this lipophilic nature, ester form, they have so many limitations in their use. But because of this lipophilic nature only, the absorption of these molecules are very high. Sublingually also they can be absorbed immediately in the blood, and that's the reason of rapid onset of action and rapid pain relief in the angina. The adverse events associated with organic nitrates are headache and postural hypotension. So since it is causing vasodilation, it might lead to hypotension. The decrease in blood pressure can be by 10 mm of Hg during hypertension, and since the blood pressure is low, in reflex to this low blood pressure, the heart starts pumping blood faster, and that's why the heart rate increases by approximately 10 beats per minute. Tolerance may be developed with the use of organic nitrates. There can be two ways of this tolerance development. First can be when sometimes the capacity of the vascular smooth muscle to convert nitroglycerin to nitric oxide is reduced. It can be because of reduced activity of the enzyme, and this condition is the true vascular tolerance. The second way can be when this tolerance is developed through some mechanism outside the vessel wall. That is called pseudo tolerance. Since tolerance can be developed with organic nitrate use, it is recommended that it should be taken at the time of an anginal attack, and when the person is anticipating that he or she might get anginal attack during this strenuous activity, that time they can take to prevent the attack instead of taking it regularly to prevent the attack. So the chance of developing tolerance can be reduced. Molcidumine is an oral nitric oxide donor. So the pharmacological effect of molcidumine will be same as organic nitrates, but the mechanism how nitric oxide is released from the molecule, parent molecule, that's slightly different here. So this molecule is soluble in both water and organic solvents. When this molecule is administered orally, it goes in the liver. In the liver, it is metabolized into its active metabolite called lyncidomine in presence of esterases enzyme. Now, how this metabolism is taking place? So, if you see here, this bond is broken down in presence of esterase enzyme, and this negative charge is coming here to form a double bond. This double bond will shift here. This double bond will come on nitrogen as a negative charge. So here is the negative charge, and here the ester bond is broken down. This is lyncidomine. Now the lyncidomine from liver is going in the blood. In the blood, it is getting converted into its nitrosome metabolite called SYN1A. So in this, what is happening? The lone pair of electron on nitrogen is forming here double bond. This bond is broken, and here triple bond, it will form a triple bond here, and this negative charge will come here to form a double bond. So oxygen valency is also satisfied and nitrogen valencies are also satisfied. Now the SYN1A is releasing nitric oxide in presence of oxygen, O2. So we know that in oxygen, in O2, each oxygen atom is having one lone pair of electrons. So one electron from one lone pair is given to the nitric oxide. And that's how it is cleaved and released from SYN1A and separated from the molecule. So now after this, the nitric oxide will show the same mechanism of increasing cGMP levels inside the blood vessel wall cell and then causing vasodilation. Molcidumine has some advantages in the whole metabolism. There was no aldehyde dehydrogenase enzyme which will cause release of nitric oxide, right? It was just oxygen which was releasing the nitric oxide from the parent drug. So that is the one advantage where tolerance cannot be developed. In case of organic nitrates, we have seen because of that mutation in aldehyde dehydrogenase enzyme, tolerance may be developed. But here, since the enzyme is not involved, the tolerance development will be less. There are few limitations also. That is, it has significant antiplatelet activity at therapeutic doses. So sometimes it might lead to side effect, antiplatelet side effect, after administration. It leads to formation of superoxide ion after release of nitric oxide donor, which is not good for human body. It has short duration of action and it is very light sensitive. So when it is administered or manufactured, everything has to be controlled. The light control should be there. And that's why the use of molcidumine is very less, in spite of such benefit. There are so many limitations, the use is less. Overall drug interaction of all the organic nitrates, uh, the two major drug interaction is with the drugs which causing hypotension. So organic nitrates cannot be given with the drugs which are causing hypotension, because already it is showing vasodilatory effect. The second class of drug is sympathomimetic drugs like norepinephrine and epinephrine, which will lead to decrease in anti-anginal efficacy. Like it's like the opposite effect. Organic nitrate is causing vasodilatory effect, and this will show exactly opposite effect, the sympathomimetic drugs. So that's why they should not be given together. Now let's see few miscellaneous drugs. The first one is ranolazine, which works by acting on metabolism in the heart wall. So we need to decrease the oxygen consumption in the heart, or somehow we need to increase the availability of oxygen in the heart wall, right? Uh, so how we can do that? Oxygen in the heart wall is coming from blood, yes, but sometimes through metabolism also oxygen is generated in the tissue, right? Now in myocardial tissue, how the oxygen is generated, it can be through two ways. Either metabolism of fatty acid can generate oxygen, or metabolism of glucose can generate oxygen. Now we all know, we have studied these basics, that fatty acid metabolism leads to generation of very less molecules of ATP, and that's why less oxygen generation will happen. Whereas glucose metabolism leads to generation of more number of ATP and more oxygen will be generated. And that's the reason, that's the way how oxygen generation is increased. So ranolazine is a molecule which will shift the metabolism in myocardial wall towards glucose. More glucose will be metabolized rather than fatty acid, and that's how more oxygen is generated inside the myocardial wall. Class of drugs are also used for breaking down the platelet aggregation in the coronary artery wall, which is present as a plaque. So low dose aspirin, oral clopidogrel, and some drugs like apixaban, tirofiban, and eptifibatide, which are anti-integrin drugs. They are given as antiplatelet agents. What is this integrin? Integrin is a transmembrane protein which is involved in adhesion of the fibrinogen. So fibrinogen is adhered to the coronary wall with the help of integrin, and their platelet aggregation is happening. So to avoid all this platelet aggregation and plaque formation, we need to block or inhibit this integrin receptor where adhesion is taking place. So that is inhibited by all these drugs. The last class of drug is antithrombotic agents, which will break the thrombus present in the plaque. The drug is heparin. So all these drugs, they are actually helping in breaking down the plaque and dissolving the plaque in the coronary artery. So that completes the organic nitrates and miscellaneous drugs in an angina management. We will see vasodilators in detail in antihypertensives. Thank you so much for watching this video.